Thank you guys for coming in to join us on this afternoon now and staying inside with us instead of enjoying the weather. But we'll try and make it worth your while. So my name is Chase DeVries. I'm with Comature. We do pharmaceutical fill finish and isolation equipment. We're going to be talking to you guys about different vendor relationship aspects. I'm joined by a couple people smarter than myself who you'll get to hear from most of the time during our discussion. So this is Jennifer and Tim. You guys want to introduce yourselves as well?
Thanks, Chase. Good afternoon, everybody. My name is Jennifer Fenwick. I'm the Senior Manager for Temperature-Controlled Logistics at Vertex. Vertex works across many modalities, and I'm focused mainly right now on the future commercialization of a cell product for type 1 diabetes. But throughout my career, I've worked both many times on the vendor side for logistics providing, as well as other therapy developers. So thanks for having me.
Hi, I'm Tim Fouts. I'm the Chief Scientific Officer of Ascend ABL, and we are a CDMO. We also help people who are interested in identifying and finding non-dilutive funding to help support bringing their product from bed to bedside.
All right, so we're going to start off with just a simple question of, Jennifer, what are you looking for in a trustworthy vendor? Somebody that you're going to work with on the long term routinely?
Yeah, so I would say, when trying to identify a vendor, and I'll preface a lot of this to say that, I'm focused in logistics, so a lot of what I'm going to say pertains very specifically to logistics vendors and logistics providers and logistics solutions. I would say that at a company like Vertex, when you're trying to identify a partner in that specific area, you really want to identify what truly are your needs. Are you going to be leveraging a provider or a vendor that can, work just simply in one specific area or one specific type of, shipping, handling, or, do they have a very large footprint? Can they support us when we're, in new markets and not maybe just in one region of the world? So being able to leverage someone that has, a strong footprint globally, I think that's, always something to look forward to look, make sure their capabilities match where you're trying to go with your company. I'd say in addition to just, general footprint, I would say capabilities within that footprint. So does this network include, talking about advanced therapies, does this network include the ability to source and maintain liquid nitrogen containers? Obviously, that's a big, mode of transport for a lot of these cell therapies that we look at. And being able to, bring in and introduce new potential shipping solutions, having those at the ready. So when, your clients, your customers come to you and look for another solution, it's maybe not something that they have to do from zero all the way up. You have maybe a catalog of solutions that are available that can be leveraged rather immediately. So I'd say those are probably hand in hand as the top priorities, footprint and capabilities.
Yeah, this is coming from a person that we were commenting the other day that supply chain became a word when President Biden said it in his State of the Union address during COVID. Remember when all the ships were stuck in California and trying to transport all this stuff across the United States? So I have a special affinity for people who work in logistics, how challenging that is. So in our case with a CDMO, what makes us unique as a CDMO, we do a lot of work with the U.S. government. I know it's a bad word now these days, but we work with parts of the government that don't have a lot of the infrastructure to support moving their product from the bed to the bedside, and all the quality supports, subject matter expertise, financial accounting support. We also do the same for groups that are maybe early stage biotechs who don't have all the infrastructure as well. And so when we look for partners to help in this regard, we look for people who maybe are bringing something new to the picture, something that is part of the solution. So if, for instance, the group needs not only to manufacture something, which we could do, but maybe they also need to do some pre-IND studies that to validate their target, validate their product. We'll go out and identify that partner, interview them, make sure they have all the quality attributes that we want to work with. They have a good reputation, all of that good stuff to make sure that it's going to work for the program. So we try to take a holistic approach. Are they going to be willing to team up with us and the other partners to bring the total solution to whatever partner or client we're trying to support?
Fair enough. Well, let me ask you a different avenue of that question. So what do you, Tim, look out for in a negative way? What do you try and stay away from? And I don't need you to relive your trauma if there's some trauma associated with some bad partnerships. But what are you specifically, have you noticed, doesn't bode well in a partnership?
Well, the easy one is when they can't pass my quality audit. That usually kills it pretty much right away. We had one instance where we had a contract in place, everything was ready to go. We were there doing the audit. I was the SME to support the program. My guys come out of the GMP suite and they look at me and they go, "Nope, not going to happen here." And I'm like, "Okay, well, guys, nice meeting you. We're out of here." So, and that happens sometimes quite a bit. Unfortunately, we try out new people. I send my quality guys over and they look at it and not going to work. They can't keep their records straight, or they think that GMP is kind of a joke. No, that's not going to work. So that's usually the big one that kills people.
And Jennifer, Vertex has obviously been around a while. They're a pretty well-known name in the industry. From your perspective, when you're vetting suppliers, there's obviously kind of give and take between new companies, old players, innovation versus tried and true. How do you see that playing out? How much does cost factor into that? We all want to know how much that plays in. It obviously is a factor, but it's only one. So what would you say to that?
Yeah, I would say, definitely the name recognition is something that would draw you to perhaps, certain vendors over others. If they've built a reputation, not only, maybe from working directly with them, but just an overall reputation in the industry. I think that's, always going to be something that will draw you to a certain potential partner. But when it comes to, like you were saying, cost, how does that factor in? And it's not always, this is not something that you're going to just simply, put out your RFPs and go with the lowest offer saying, oh, if they tick all the boxes for these capabilities, let's go with the lowest price tag. Obviously, we all know that in cell therapy development, there's so much expense that goes into every step of the way before you get to the logistics, that if you're going to take a risk with logistics, you might end up completely erasing all the hard work and expenditures that you've done thus far. So it's not always, the cheapest solution or one that, maybe fits the bill and let's go that direction. But I think that's where, you need to be nimble, and logistics is maybe where you need to be the most nimble. And if you have a partner that can match that ability to, flip on a dime if your shipment's not going well, or they need to have a backup lane or solution for you, you can see that they've thought about what these potential risks can be. I think the quality management aspect obviously is a big part of that. So you have to really understand how do they approach quality issues when they come up. And I think all of those things together, the cost or expenditure, the quality management, the ability to be flexible when needed, those are really, key things that you can't always put a price tag on. So important to vet all those out to see where you stand and how they measure up, just to make sure that it's going to be a good fit. Because ultimately, once you sign those contracts, this is not going to be a short-term relationship. You don't want to have to onboard new vendors all the time if you've made a mistake. So it's really important to do the pre-work before you finalize those contracts.
Yeah, I think that's important. When you're working with some things that are the subject of this particular conference, these things are not easy to do. They're very difficult to make. these products, things are going to go left. They will. And so you got to have partners that are willing to like steer the ship with you, that, you know, when your client is upset because, you know, we didn't anticipate that, well, that wasn't going to work that way. You know, you got to have a partner who's willing to come in and say, okay, let's work together to figure this out.
Right. So that's an interesting point, because so on my side, supplying equipment stuff, we're obsessed with innovating. And I think most people supplying in this world, we're such an innovative industry. So my question to you, Tim, is, do you see, like, what do you see as the best mix of predicting what you need versus just listening to your needs? Because sometimes we get caught up trying to fill a need for you and then learning what you need afterwards. And sometimes we almost feel like we're just listening to you as opposed to trying to actually solve something for you. So if you could help me out with that understanding of how you view that.
So the biggest challenge I have is that a lot of times when we're talking to people, they give me the solution that they have.
Okay.
And I'm not looking for that. I'm looking for the solution that I need to have, not the one they can give me. It's something, okay, we may have to take that and tweak it or do something different with it to get it to work for what we need. And some people are willing to swing with that. Some, nah, we ain't gonna do that. You got to take what we got to give you. I'm like, no, you know. So, and you know, and the same with CDMOs, right? So, when you're looking for a CDMO partner, a lot of times CDMOs, they have a process to make, you know, AAV or Lenti or whatever your product may be. If it fits into the process they have, you're golden. If it doesn't, and for some reason it doesn't behave the way they expect, well, sorry, we're not the partner for you. Then they drop the program or they ghost you or whatever. And so you kind of want, and especially in this space, you want somebody who's willing to dig into the science, work with you to figure it out. And you know, in my position, because we have this kind of dual offering, both the CDMO ourselves, but also as a group that goes out and seeks CDMOs that offer capabilities that we don't have. We know a lot about how CDMOs operate, and what I have found is that if it doesn't fit into their groove, they tend to not to want to do it. And that's unfortunate. But that's just the reality. And why? Because it's difficult to do that. If it's hard, it's more expensive. You know, they have to challenge themselves. And to me, that's the science. If you're only interested in getting it into your groove, why are you doing this?
If I can tack onto that, I would say that there's also a component, though, of knowing what you can offer. And if you can't offer what they need, it's if you don't become their partner, it's at least building trust to say, hey, I know what my limitations are. I know that's not going to fit with what you need, so I'm not going to try to make you go in a different direction. I'm going to say, well, maybe this isn't the right opportunity for a partnership here. So I think there's some kind of, you know, balancing out of what being flexible versus.
Well, I think it's also an artifact of where we're at, right? So where you're sitting is you're a phase 3 commercial, right? So you don't want it to vary. You got to stick. You got to make it stick, and it's got to stay that way. In my case, everything goes left or right. It's all phase 1 stuff. So a lot of times people don't know how to make it, and you got to figure it out. And so. I like that space as a scientist, because you really get to be very inventive and very innovative, and you get to, you know, try to challenge your team to say, okay, we got to come up with a different solution. This ain't working. That's great. But I can appreciate that past my stage where you're getting phase 2, phase 3, you're trying to get it to be, it's got to be predictable. It's got to be, you know, standardized. We can't be varying things. We've got to have partners that are delivering on time, reliable. You know, that it's a very different mindset.
So with that reliability, Jennifer, I'm sure you have some trusted partners that you've used in your extensive experience. So what have they done to earn your trust? And maybe it ties back into what you were talking about with knowing their limitations and saying something that isn't in their wheelhouse. But What comes to mind when you think of the people that you have learned to trust? What brought that to be something so long-term for you?
I'd say kind of fundamentally, it comes down to communication. Not only when things are going well, but when things are not going well, and recognizing that, if you're putting your trust into this company or this partner to carry your product over the finish line, you need to be 100% confident that they are doing that with your best interest in mind. And so if they are the type that can come to you when things are not going well, saying, hey, this solution is not working out, we need to think about something else or switch directions, I think that says a lot to, maintaining that trust. When I was actually talking out in the hallway with a former company that I used to work for when I was on the vendor side, and what he said that was really important was that, there's trust and having trust, but once you lose trust, getting trust back is even more challenging. So once you've proven that maybe, you don't have the same priorities or treat them in the same way, that can say a lot about like ever wanting to tackle like a future partnership or something like that. So yeah, just, communication definitely is a fundamental. And just really, I would argue, because again, I've been on the vendor side, your vendor almost needs to understand your business better than you do. So they can look out for what specific risks would your supply chain, maybe you haven't thought of in your supply chain. So having that deep understanding, being able to ask the right questions when you're kind of approaching that partnership potential relationship, I think that speaks volumes and is only going to set you up for more success down the line when things eventually do go wrong. So it really starts from the very beginning.
That's fair. Yeah, so Jennifer actually didn't know this when we met, but Comature has done and is doing some work with Vertex, and it's been a very interesting process to go through personally being involved in it, because I'll admit we have not been the perfect partner to them, but that communication has been so evident. So you started talking about something near and dear to my heart with the communication there, but it also makes me a little uncomfortable sometimes. I had a mentor that said, every decision we make is emotional. And that didn't sit well with me as an engineer that loves a good spreadsheet. My personal calendar is a spreadsheet, much to my wife's chagrin. I love that kind of atmosphere. But he said that with the personal relationship. And so, Tim, I kind of wanted to see what your thoughts were as far as where's the balance of dealing with, say, a company and a contract versus a person. Where does that relationship and trust come in for you in that sort of a dynamic?
Well, I agree. So when you create these partnerships to bring solutions forward, it's like almost like a marriage, right? You got to communicate. You got to like be all in the trench together, and communicating is very important to that whole equation. And you get to the point sometimes where you don't want to. You want to stick with this person because you believe they can do it. But at some point, there may be a point where you realize that it's not going to work. And you got to be willing to say, it's not working. We got to either come up with a different solution or we're going to have to part ways. And that's happened to me a few times where I just say, yeah, sorry, not working. We're going to go in a different direction. And that's a hard thing to say. Sometimes the partner doesn't like it very much, but you can't. That's where the spreadsheet comes into play, right? In the end, it's a business. If the guy isn't delivering, and you've given him the chance, then you got to call it, even though he may be your best buddy.
Right, that's fair. So that's a kind of a question for you, Jennifer, especially with dealing with all the logistics of this stuff. Have you ever had issues where you almost become too entrenched with a supplier? Maybe you're finding it tough to look elsewhere because you've used them before, and like what Tim's saying, the performance has changed or something like that. Have you ever had an issue with that, or how would you handle that?
Yeah, I mean, there's definitely times in my career, maybe not simply at Vertex, but you rely so heavily on one partner to do this one aspect of your service, and that when it goes not the right direction, it's hard to pivot. It's really hard to then all of a sudden, start this process all over again. So I think one way to mitigate that, maybe not fully eliminate, but if there's opportunity to have a primary and a backup provider in certain areas, maybe one is a primary in one region and it is a backup in another region, just based on, like I was saying earlier, footprint, network, capabilities. But then you know that you're not going to be so locked in that it might potentially cause big problems for your shipments, for your drug. So yeah, being able to identify where you can leverage like a backup partner, and shift business temporarily or even long term. If you've become too entrenched with one and they're not performing, then you might say, okay, well, good thing we have this backup already identified. We can make a relatively easy pivot. It'll still take some work, but it won't leave you in such a lurch where you just have to keep suffering through it until you go through the whole, contracting, identification, and all that.
I do love a backup plan, especially when we're dealing with medication that's so important to people's lives. Tim, a question for you on how are you as a CDMO, how are you getting with people and asking the right questions to get to the bottom of this stuff? So we've heard it a couple times about asking questions to find out what could go wrong or that sort of thing. Like, how are you ensuring that you and your team are going to vet this properly to help somebody like that?
Well, okay, so recognizing that many times when we're doing something, it's for the first time. Nobody's ever done it before, right? So we've never made this product before. Although we may have made AAV before, it's not the same one. You're putting in a different gene. It's going to change the characteristic of the virus. It's going to change all this stuff. You may influence all kinds of different things. You don't know. Now, hopefully you've done enough of it that you can, and this is where you ask people, okay, some questions around, okay, how many times have you done this process? How many times have you made this kind of a product? How many times have you had to do this or that? And you can kind of get a sense of what their experience is around this. Now, that works to a point, because if you're doing something really new that nobody's ever seen before, you're going to have to kind of try to see what fits, and have you done something like this or something like that to see if there's some convergence that you can kind of focus in on to dig in. So, and with CDMOs, it's all about experience. Do they have the, in our case, we work on all kinds of different things. So a lot of times when somebody comes to talk to us, they say, well, have you done AAV 3.2.5? I'm like, no. Of course not. But I've done transient transfection processes out the wazoo. How different is it? And it could be different, but for the most part, that's kind of what you rely on. So you try to juxtaposition experience that they may be working on to see how close it is to what you think you're going to have to deploy. But ultimately, what is probably the most important thing to me is, are they actually thinking about what they're doing? And I can tell a lot by how they write their proposals, because if they give it back to me and the proposal is, this like something they cut and paste from a bunch of different things, and there it is, here's the number, rather than they come back and they've done a deep dive into the indication, they know where the position, how this drug is going to be positioned, they understand how it's made, and they've done some homework around what are going to be some of the problems. That group, I'm going with them, because they're thinking about it. They may be twice as expensive, but they're thinking about it. Well, this other guy, I don't know what I'm going to get.
Right. So it's worth it when you can see that kind of value add at the start.
Yeah, that to me, above everything, if they're actually thinking about the science behind what they're doing, not just the product itself, but how to make it and all the nuances. And they're bringing, when you go talk to them, and they're bringing the guy into the table, and the guy talking across from you is asking really good questions, then you know you're onto something. But if they're just kind of like, well, how much you going to give us? How much you need? Okay, well, we can deliver this in 4 months. Yeah, okay. Well, what if things go left? Which they will. What are you going to do? This is where that to me is where the, in where I work in this phase that I'm in, it's all about, are you bringing the right people to the table who know what they're doing and are actually reading the literature and following the science? That's the big thing.
Yeah, I think that is ultimately what it's all about. Is once you approach this partnership from both sides, what you need to have confidence that the other one can potentially be, the right partner for you. And so if they are asking the right questions, if they are, thinking about nuances in your work stream or your ultimate goal, they're already proving to you that they care, that you can be confident in their abilities to execute that on your behalf. And so, the confidence starts from, the communication piece. It just starts from, the very beginning.
That makes sense. Yeah, so we've started talking about asking all these questions and getting in there with things. So when these questions come up, concerns come up. And concerns are what we don't love in medicine, of course. And so we do our best to mitigate them and such. But for you guys, when would you move somebody from, in your mental mind, from a vendor to a partner? Does it take a certain amount of conflict and questions in there to resolve those? Or do you get to this stage early on where they've asked questions like that and you're like, that's my partner already?
Yeah, so I think for me, it's usually right in the beginning, right? When you're going to do the visit for either the quality audit or, some sort of like technical audit, and you're sitting around, you're walking through their labs, right? You're talking to the scientists at the bench, right? And you're asking, well, what are you working on? And he tells you, and they're thoughtful about it. You can kind of figure out, okay, these are the kind of guys they hire. You can talk to the guys in charge, and they're asking you a lot of intelligent questions. Then you got a good feel that, okay, these guys can think deeply about a problem. That's kind of what I look for. And so for me, I know automatically based on those kind of conversations that these guys are going to be the ones that are going to work with, because when we will run into a problem, they're going to go back and dig into the literature and see if they can figure it out. And that's what I want. Instead of them just throwing up their hands like, well, it didn't work in my system. I don't know what to do. That's helpful.
Yeah, if I could just add to that.
With the voice?
Yeah, well, I'll leave the voice out, but I'll let you do that part. I think you have to almost think about it as like any contract you sign for a vendor that's you're outsourcing work to, you have to think that it's going to be a partnership immediately. We all know how laborious these, contract processes are and everything, these long conversations about capabilities and, deliverables and
how
KPIs
you get divorced. No, seriously.
Yeah,
why do you write a
that's a lot.
contract?
Yeah.
Because you have to think about how you're going to get divorced.
Yeah.
That's what the contract is about.
Yeah.
Not just what you're going to do.
Absolutely.
But when you screw up, how we're going to get rid of each other.
Yeah. So going into it on both sides, saying, okay, we're forging a new partnership. I don't think there's anyone that's taking lightly any vendor that they outsource to. So you really have to, the trust, the communication, the confidence, and those are all the three things that that will give you that partnership feel. So if you're going into a contract situation with someone, they're doing work on your behalf, you have to know that that's your partner. They're executing for you. And so if they don't succeed, you don't succeed.
Yeah. I think with us, we routinely talk to people about, okay, you're going to have 12 to 18 months of a project with me, but you're also going to have 20 years of utilizing our process. So you're going to have to deal with me for 20 years. Which can sound like a threat if it's a bad thing, but it also means like you've got to be in a place where you're partners, because you're going to work on this a long time. And I think with what you guys are talking about, sometimes this kind of gives me hope, because when I sit down and I see a title like Chief Scientific Officer and I realize, oh crap, this person knows a lot more about this than I do. I think there's a tendency that we, as professionals, we look at it and we go, well, I don't necessarily want to ask a lot of questions and maybe tip my hand that I don't necessarily know this piece. But I found it super useful and I've been thrilled with this industry when people work with me as a partner on that, as I show my own limitations in order to partner with them in the best way. You guys have any last remarks for the people before we let you on your way?
No, I think this is a great conversation. I think finding good partners is one of those challenges we all inherit to what we do, but it's completely rewarding when you find when you're in the trench, you've got a problem that's really difficult, and then you're working with somebody and you're on a Teams call and everybody's struggling, and then somebody comes up with an idea, and you're like, dang, that is a good idea. We should try that. And it works. And then you're thinking, wow, that's great partnerships. And that's what I always look for and I celebrate, because when you get the right people in the room and somebody's going to come up with a great idea, and it likely will work.
Amen. Well, these two are going to stick around for at least the next 14 hours in the back corner for any questions you have. You can give them a round of applause. I appreciate their time.